Every week, the Payne family cuts straight to the real financial story.
The one question, Bob, everyone's asking is, are we in an artificial intelligence bubble? You've been through boom and bust. What do you think?
No hype, no myths. Just what actually matters to your money.
Does feel very similar to what we experienced in the 90s. Where are we, though? Are we in 1995, 1997, 1999?
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.
Sunday morning. With us like every Sunday, Dr. Peter Michalos. Live long and prosper is the nickname we gave him. And Dr. Michalos, we all want to live to 100. How do we get closer to it?
Well, today, John, we're going to talk about another interesting topic that we don't hear a lot about, but we all deal with it every day in our lives, and that's mold, and how mold can affect our longevity. It can shorten our longevity. And it turns out that mold is a driver of inflammation, and it affects the immune system. It can basically be an immune disruptor. And there's even certain molds, like aflatoxins found in aging peanuts, that actually can cause liver cancer and also associated with pancreatic cancer. And that was why peanut farmers, for example, in Jimmy Carter's family, they had a whole bunch of people who had died of cancer because they were exposed to peanuts. In the old days, they used to keep them in a barrel and you can shop for them. They don't allow that anymore because they grow mold, and the aflatoxins are known carcinogens. Now, in a house, where does mold grow? It grows in moist environments. It grows on sheetrock, it grows on wood, it can grow on wallpaper, it can grow on insulation, and carpet is one of the worst places for mold because mold needs moisture and it feeds on organic matter. And believe it or not, our skin does shed, and that is actually food for mold. And these mycotoxins that are produced from mold can cause coughing, sneezing, allergies, asthma attacks, and wheezing. And what you can do is you have to be able to try to mitigate mold. And you and I have talked about some of the things that you can do, including dehumidifiers. I keep an industrial grade one in the basement because I have a drain. So basically you set it to 30% humidity, and year round it keeps it that way, and it reduces your chance of having any type of mold growth, especially the really nasty, dangerous one that grows on sheetrock called black mold.
Do you use distilled water, doctor?
Not for drinking. I'd rather use a mineral water. For certain things you can use distilled water.
No, I'm talking about for the humidifier.
I use filtered water, whole house filter, and then I have a filter that basically is a countertop. Fill it up with that water that's already been filtered, and then you just filter it out so that it's very clean water, and you get rid of the microplastics as well. But distilled water is fine. It's fine to use as well. It's just extremely expensive to keep buying. It's much cheaper to have a very high quality whole house water filters. But getting back to filtering the air, in Florida, for example, and in hospitals, they have big UVC lamps in the central air handler, and as the air passes through that, it fries and kills the mold, virus, and bacteria, and that is very helpful, and that's why Florida also fared better, because the rooms that have the UVC light, it helps, and also the portable units that have a HEPA filter and UVC to kill the mold, and other things that you can do to mitigate it. Even your wet towel in the bathroom, you have to change them frequently because that wet towel sitting around also is a place where mold can grow as well. So these are some of the things that we have to be aware of, because these molds are basically, they're like tiny little seeds. They're called mold spores. And mold has its role in the universe. It actually eats dead organic matter. That's what eats up your leaves outside. But, it can also chew on fabrics and dust. But when you see those black spots on your sheetrock, painting over it doesn't kill it. You have to sometimes remove the entire sheetrock because the insulation is contaminated underneath. Bleach works very well to try to kill all the mold. You have to clean it up, get rid of the old insulation, and then you can repaint. And now they even have paints that are specifically mold resistant. And these are, some of the things that you can do for mold mitigation, because now we know about all these other things that it can cause, like the cancer, and it's even a hormone disruptor, and it's been found to even cause neuroinflammation, and that's brain inflammation. And there is a test that is made by a company that you can check your urine, and the mold metabolites show up in the urine. One quick case, a lady who had skin lesions was seen at all these different hospitals in the Northeast, Ivy League places. They kept giving her steroid creams for her skin, sent her to an integrative medicine specialist and Dr. Magdalena, and she did a urine sample test, and it came out mold. They treated the mold, and guess what? All the skin lesions went away, and I keep getting thank you messages. So that's a fascinating thing that you're not going to get elsewhere. So that's something that you have to think about when you have, chronic wheezing, coughing. You can do mold testing in your home, and there's even a urine test now that we can actually test to see if we have those mold metabolites. So mold, you have to be careful, especially in immune-compromised people who are taking anti-rejection drugs, for example, who've had transplants. Those people's immune system is down. They're more susceptible to mold infections. It could even cause a sinus infection. That's why it's so important to keep your air clean and keep the moisture level under control. I keep a $10 hygrometer in each of the rooms, and I know what the percent humidity. So ideally, I like to keep it between 40 and 50%. You don't want to go above 50% because that's an environment that causes mold to grow. So avoid mold. Those are some of the tips. Keep listening to WABC for more tips on staying healthy.
Dr. Peter Michalos, thank you for your tips, and thank you for keeping our listeners living longer so they can listen for longer. And God bless you, and God bless America.
Thank you, John, and thanks for always getting the medical truth out on the Cats Roundtable.
Every week, the Payne family cuts straight to the real financial story.
The one question, Bob, everyone's asking is, are we in an artificial intelligence bubble? You've been through boom and bust. What do you think?
No hype, no myths. Just what actually matters to your money.
Does feel very similar to what we experienced in the 90s. Where are we, though? Are we in 1995, 1997, 1999?
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.